I'm John DiFiori. I'm a sports medicine specialist at HSS, and I serve as chief of the primary care sports medicine service, where I focus on diagnosing and treating sports-related injuries. The vast majority of sports-related injuries don't require surgery, and most of them can be treated with careful diagnosis using advanced technologies and a careful history and physical examination, and we can treat those injuries without the need for surgery. But in some cases, here at HSS, we work really closely with our surgical colleagues so that if we do have something that requires surgery, we work together with them to make sure they get the proper surgical consultation. A lot of my career has been spent on the sidelines with high-level athletes in football and basketball and in training facilities. But what I've done with that is we've learned some different techniques and really unique applications of treatments that then we can take to the patients that I do see in the office, which range from young children all the way up to the most senior citizens, because everyone enjoys being active. My goal as a physician is really to work together with my patients to understand what their goals and expectations are. We can usually make a fairly precise diagnosis, but really the art in this is to understand what we need to do to help our patients get back to their activities to the best that they can. And it's really important for us to be able to help them with something that's important for them. To have a patient come in with a problem that they were very concerned about and being able to make a diagnosis, to help them understand what that is, and to help them recover from that injury and get back to something they love is really so rewarding. Patients will often say, I was able to run that race, or I was able to go on that trip and I did great. And as a physician, that is probably the most rewarding thing